are working under a shortage of supplies, PPEs, personal protection equipment. As you know, we were approved for 4 sites, 2 in the city, 2 in Harris County. We have set up one of the sites in the city of Houston, which is standing and has been in place since, I want to say, Friday of last week. And then the county has stood up 2 sites, so there are a total of 3. All 3 of those sites, I believe, are continuing to function, testing sites today. But whether or not we'll be able to continue tomorrow is highly problematic because we've been waiting on a shipment of PPEs to come into the city of Houston. And to further elaborate on that, let me yield to Dr. Purse, who can speak more specifically on that topic.
Thank you, Mayor. And it's a good question. I think you need to keep in mind that there are multiple things that need to be available in order for the testing site to go. So we've talked a lot about the swabs and the viral media. We've talked a lot about N95 masks. And there are other things that we need, the gowns, the gloves. One thing is, which the public may not be aware of, is that after we take the sample, the viral media with the swab, and it needs to be kept cool. So one of the things that we've come up against that you may not have expected would have been a problem is the coolers and the bags. There's special cooling bags that they need to be kept in. We think we've got that problem solved, but my point is that there are many, many links in that chain, and when any one of them becomes short, it can bring the whole system to a grind. I want to thank the public who has stood up. We've got a number of folks in the public who have come forward with N95 masks and other personal protective equipment and donated it to hospitals and to the city, and that has helped us bridge the gap between what FEMA has supplied and kept us going. So I want to thank the media for getting that word out, and I want to thank the public for having brought that forward, because that has, filled some of those things. And so, as the mayor said, right now we're looking good for today. We're going to get through today. And as the mayor pointed out, the city has 1 site. We're pretty robust out there. We're getting a lot of folks through. That's working really well. We have not maxed out on how many folks that come through there. We can do 250 a day. We've been in the 225 range. And so by opening a 2nd site, we're concerned that would then dilute our resources and we may become actually less efficient. So we're going to stick with the 1 site because it's working well and we haven't maxed out there. And once the supply chain issue from FEMA gets squared away and it's more reliable, we'll then consider going to our 2nd site.
And Mayor, when I talked to FEMA about this yesterday, they indicated that, Mayor Turner, it was a problem, perhaps at the state level, that they said they were shipping things directly to the state to then distribute to counties and cities in the area. What's your understanding?
Well, we've been working directly with the Texas Department of Emergency Management, which is the state. So we've made our requests known to TDM. And they've working with us to get the supplies. We just have not yet got. We were hoping to get a shipment on yesterday. The shipment did not come in on yesterday. We are hoping to get it today, but we're still waiting. Let me just put it that way. And it is important for us to do the testing because that gives us a pretty good indicator of the degree of community spread out there. It helps us to know at what point, whether or not we are being successful at blunting it, but we know the numbers are going to go up. I mean, in the city of Houston, as of right now, we have about 55, as of right now, cases, but we know that there are a lot more out there. So the testing, the evaluation testing sites are very important. I do want to acknowledge, for example, the Asian Chamber of Commerce, which the other day provided us with gloves and gowns, which is helping to supplement what we have.
Talk to us a little bit about, we've had some city employees email us, to be honest, and they're like, well, they say stay at home, but then they are telling us to come to work. We don't think we're essential, whatever job they're at in the city, and we think we should be allowed to stay home. Can you talk to us a little bit about the guidance you've given?
The city of Houston, in terms of its government operation, we are essential services. As you know, that there are 16 industry categories that have been classified as essential services based on the CISA analysis. And so whether it's energy, health care, the food chain, residential and commercial construction, we, the city of Houston, the employees here, we supplement all of those different entities. For example, our first responders, they're city employees, police and fire. Public works, they supplement all of the other services. Municipal workers supplement. Without municipal workers, you can't have police and fire. Now, are we operating, bearing in mind that can we do things in a way that help to protect city employees? The answer is yes. And as you know, the Houston Public Libraries, we're not open to the community. Municipal courts will be suspending all of their hearings, courts, arrangements until the first week in May. We are doing things more online, teleconferences, where you can work remotely from home. You can work remotely from home. And so, the city, you can't close down city government because we complement and support all of these essential services. Now, what I've said to employees, to the extent you can work remotely, and where we have reduced the level of community involvement, and where the directors are saying that we are needing employees to carry on these respective functions. If employees, for example, if they just feel uncomfortable and they don't want to work, they certainly can exercise their vacation time or their accrued sick leave time. They can do that. But what the city of Houston, the government, cannot do is that we cannot afford to send thousands of employees home who are not able to do their jobs remotely, but they're just going home and then continue to pay for them while they're at home. We just don't have that ability.
And on that same token, just to, trash service and all that stuff is ongoing, right?
And that's the other thing. People are at home, but people still want their trash picked up. Those are City of Houston employees. So when you look at all of the different departments, from a financial point of view, we still have to govern financially. So all of those employees, those who can't work remotely, are needed. 311 services, to the extent they cannot do it remotely, they are needed, okay? City council operations, that continues. So I certainly understand the anxiety level that's out there, that's real. But the reality is that we are public employees. We are public employees. And we, too, are on the front line. And we have to be available to make sure that the city continues to run and the 2.3 million people in the city, that their needs are met. And those are the realities. But we are doing everything we can to reduce, let's say, community interaction. We want to certainly practice the 6 feet rule, work safe, so we want to do that. Social distancing within our city departments, that's critically important. But we cannot, and we are not in a position to tell employees, you can simply go home. Just like even in the media business. You can't say to reporters and everybody else, you all just go home. Now, you can't go home, but in many cases, you're still doing your jobs. It's the same way here.
Mayor, yesterday some of the executives from the Texas Medical Center, leaders of the hospitals there, expressed concerns about capacity, saying, for example, for adults, that they're already at 70% capacity when it comes to bed space. So the question I have is, are you considering opening hotels or using hotels, closed hospitals, and other facilities, identifying those as potentially makeshift temporary hospitals? If so, which sites are you looking at?
Well, we're looking at all potentially available resources, building spaces. And so I know, for example, Andy Eakin has been looking at different buildings. We've been looking at, let's say, buildings that were once hospitals that are now vacant. We're looking at those items. We are already working with a couple of hotels to lease room space for people who can't, for example, self-quarantine at home, employees, first responders, even people in our homeless community who can't quarantine. And so we're looking at spaces. We will be solidifying, or in the process of solidifying, lease arrangements with 2 hotels that will provide us with an additional 180 rooms. So we're already doing that. In terms of hospitals, additional space, we have identified certain buildings, facilities in the city of Houston, and we've made that information available, for example, to our hospitals and to the Texas Medical Center. So yes, steps are being taken.
More specifics, what buildings are you talking about?
I don't want to be any more specific at that time, because some of the negotiations are still taking place. Right. No, I'm not going to do that. You know, we have a number of hotels in the city of Houston, and they're fine hotels in the city of Houston. And as you also know, the business that those their vacancy rate is very, very high right now as a result of the virus. We are negotiating and in conversations with several hotels in the city in terms of leasing the necessary space for first responders, city employees, and other people in our city, let's say like the homeless population who cannot self-quarantine.
Of the CDC grant, when is the 5 million available and how it's going to be used specifically?
The grant has already, that's the CDC grant, $5 million to the health department. That has already been approved from the CDC, and the council gave the approval today to accept that $5 million grant. But that will be used for, it's pretty much a broad-based sort of grant coming from the CDC to combat and fight the coronavirus.
Mayor, can you talk to us a little bit about, this is the first day of the stay-at-home,
Yes.
work safe thing. We drove around this morning, and there were still a lot of businesses, that are open. There's a lot of exemptions, or there's people who are trying to fit their business into an exemption. What do you, there's a lot of people who are also saying, hey, my boss is telling me I'm essential, they're making me go to work. What do you tell those people, or what do you tell their employers?
If they,
the spirit of, like the letter of the law versus spirit of the law, you should sort of.
number one is a stay home, work safe order. Okay, it is the first of its kind that we're utilizing, but also this virus is the first of its kind. Essentially, what it's saying, for example, is that if you are, and there are 16 categories of essential businesses as defined by the federal government. And so people can go to the Cybersecurity and Infrastructure Agency, and they can read, for themselves, or just read the order, what those 16 categories are. And it's the energy sector, the healthcare sector, the food sector, IT and communications. There are about 16 energy sectors that are deemed essential. And then what it says is that those businesses that directly support those industries, they are a part of it. In addition, you have elements like your gas stations. Those are open. The laundromat, cleaner services, they are open. And the rationale for that is that when we're telling people to stay home, okay, and then you have essential employees that are having to work, you still need those type of services to support them. Plumbers, electricians. You can't tell people to stay home and then they have housing issues, okay, that need to be addressed. So you need to have your plumbers and your electricians. So that's how you get to that analysis on that end. So what I can say to you.
Like car dealerships are still open, I believe?
That I'll have to look at it. I can't speak specifically on that.
We've had a number of people telling us.
Yeah.
They're still selling cars, still showing houses. Realtors are showing houses.
Yes. And again, all related to residential, I guess you could say consumption, okay? We have tried to strike a balance between your healthcare needs and still your basic business economic needs as well. To try to strike a healthy balance is what we've attempted to do. But for example, if you are working remotely from home, and you can work from home, we want you to be at home. Okay, we want you to be at home. If you are not an essential business and fit within those categories, you need to stay home. You just need to stay home. Now, that doesn't mean that you can't go to the grocery store. Of course you can. And if you need to go to the pharmacy, of course you can. And if you want to go, for example, we keep using the park, you can. But in all aspects of your life, you need to engage in social distancing. You need to maintain that separation.
If people have a complaint about their employer not complying or forcing them to go to work, do you guys have a hotline?
Yes, I want them to call 832-393-4220. 832-393-4220.
And like, what part of city government is that?
That's Harris County.
Okay,
That's the number that Harris County is making available if you have any questions. And yes, if you have a question as to whether or not you are an essential, you're working for an essential employer, then you should call to get clarification. Okay. But the reality is, let me just say this: to the extent you question that, then you probably should stay home. I mean,
I think the issue that we're getting on our end is not that employees feel like they should probably stay home, is the fact that their employers say, well, like we are, like, we get questions from, say, somebody who works at a garden center. They're like, well, our employer said we are agriculture, so we should still sell,
I got you.
like, plants.
I would
for
say
your
call
hedges.
this number. Like let me just say, like there may be some city employees that say, we are not essential, so we ought to be at home. But the city of Houston, the government, is an essential employer, okay, because we support everyone else. Now, there are ways, even if you're essential, that you can also work, where employees can work remotely, then they need to work home. The media is essential. But there, employees within your own shop are working from home. You're essential, but there are safe ways of working.
Have you thought about has the GHP sort of talked
Yes.
to their membership and said,
There's a 10-point plan working with the Greater Houston Partnership to work with employees, essential employees, on a work-safe plan, that we are checking the box to make sure that even essential employees are practicing safe and implementing safe measures. So that's a part of the equation. Because even if employees are having to work, that's the other part of the order. Work safe. Work safe. So, and that's what we want to emphasize. Everybody has to take the sort of measures to protect everyone else. Because as I indicated yesterday, my destiny is in your hand and your destiny is in mine. Whether you're staying home or whether you're working at an industry that's been deemed essential, we all need to take the necessary precautions.
Mayor, some questions from other TV stations
Yes.
I'm pool. So Greg Rugen at KRIV says, Councilmember Travis expressed grave concerns, saying he's seen more than 10 people riding Metro buses at a time. He called it a death taxi. Are you concerned about this, and will you issue a directive?
Well, Metro has already put in place and taken steps to enhance, to make it the transit system more safe. Have taken safety measures, for example, on buses, and I believe also on the transit system, they have blocked off certain seating in order to provide some social
But it
distancing.
sounds like from this question that more than 10 people are being allowed to ride. Is that the case, and should it be?
For many people in our city, they don't have cars and trucks. Those are the realities. They have to get, if they work for an employer that's deemed essential, they have to get to their place of business. And for many individuals who don't have cars or trucks, the grocery stores are open and they need to get there. So that's the balancing that we haven't take into effect. But Metro is very much sensitive, and Metro has already taken the precautions and the steps in order to bring about social distancing and then to protect people. And they are cleaning, disinfecting those buses and trains a lot more often now than before.
I have some questions from KHOU now. The first, you addressed this, but just for the purposes, has the city, county, or city received more COVID-19 tests? Have you gotten more tests? We talked about PPE, but have you gotten tests that you need as well?
So the FEMA sites are really our sites now, and we have right now we have adequate number of swabs and viral media. Right now, and this kind of goes to my comments earlier about any link in the chain could be the rate limiting step, right? So right now it's the PPE, but right now we got enough swabs.
Okay. Secondly, how will HPD enforce the new stay home, work safe order?
Well, Chief Aceveda, Chief Pena, the fire department, Chief Ed Gonzalez, all of our law enforcement personnel are working to coordinate their own plan on how to enforce. It also is going to require a lot of compliance from individuals as well. That's a part of it. I think the hope is that people will understand the seriousness of this issue and that they will engage also that they will comply. If, for example, someone may be stopped for some other reason, okay? They ran the red light and then comes to discover that they are just out and about, then that could be an issue. But nobody is just pulling people and just saying, do you have any paper indicating that you're working for an essential place? We're not doing that. And also let me underscore, this has nothing to do with immigration. So nobody's going to be asking about their people's immigration status. I want people to understand that. But they will enforce it as best they can, coordinate it like they do anything, coordinate their efforts amongst themselves. But it does, in large part, require people to comply with the Stay Home, Work Safe ordinance.
A third question from KHOU, are lawn crews and cleaning crews allowed to keep working?
Yes.
Fourth, from KHOU, what are the latest numbers and conditions of city workers in quarantine?
City workers in quarantine, I'll have to get that information. I don't have that information readily available to me. And you're talking about separate and apart? I know police and fire have provided those numbers. So I think you all have.
All city workers,
Yeah, in terms of just municipal workers in general, I'll have to get those numbers. I do know we made the numbers available for police and fire. Sure.
Quick question, we have been receiving calls from residents that have been losing their jobs and pretty much don't have any money to pay their bills. So what's the city doing in order for them to help them out in this crisis with the bills? I know the water system will not be shut down until May, but what about electricity and gas?
And I don't believe that Centerpoint are disconnecting people on their utility bills. I know the Public Utility Commission in Austin is meeting to see what additional steps utilities and retail electric providers can do to assist people on their utility bills. They may be meeting this week on that. We certainly are not going to be disconnecting people on their water through the end of April. We are looking at ways now to assist some small businesses in terms of delaying permitting fees and some things of that nature till later on in the year. So we're looking at different measures on how we can assist.
Another question, parks still open?
Yes. The park's open, but not the equipment, not the playground equipment.
We were still seeing people in the parks using the playgrounds and stuff like that. Is there any special signs that you're going to be putting in the parks or maybe increasing the patrol in the park so you can prevent people from using the playground?
Well, we're certainly looking at doing that. I think we've closed off the playground equipment already, or we should be closing out the playground equipment. We are keeping generally speaking, the parks open because, people are just not going to just stay confined, for example, within their homes. We are encouraging people, you don't necessarily have to go to the parks. You can still walk in your neighborhood, or you can jog in your neighborhood. But whether you're jogging in your neighborhood or whether you're in the parks, you still need to engage in social distancing. Social distancing is key. And let me go back right quick, because
I'm sorry, that number's wrong. Harris County gave us the wrong number, so please disregard the number we gave you. We'll get it correct.
Okay.
For Dr. First, I don't know if you mentioned, so the problem right now is the PPEs, not the testing, not the swabs. How many swabs do you have? How many days still?
So we're going through, at our site, we're going through about 200 to 225 swabs per day. And if I'm remembering correctly, we've got about 3 days worth. The FEMA said that we would get another shipment this week. We just don't know which day this week. So today's already Wednesday, so we're hoping that we'll get that next shipment before we run out of the swabs.
So the shipments that you're getting, is it weekly or what's the time?
We've been told it's weekly, and as you know, we've got the first shipment, and we've been told the next one would come this week, and like I just said, we don't know which day this week, so that routine has not yet become routine. So we're waiting, just like you are, to find out when it's going to arrive and exactly what will be in the shipment.
In terms of PPEs, it's all right, like you have for
We've got enough for today, and again, as the mayor pointed out, thanks to the Asian Chamber of Commerce, because that material that you saw in this room just, the other day, was actually already being used. So we've got enough for today. We think we got enough for at least part of tomorrow, but through today, we're trying to get more so that we'll be able to get through tomorrow as well.
Are you still encouraging the public to donate it?
Absolutely. There are lots of medical, dental, laboratory, nail salons, all kinds of places in the community use N95 masks and gloves and gowns. And if there's anybody that has something they would like to donate to the city or to your local hospital, because they're also in the situation, we would really encourage them to do that. If you want to donate to a hospital, I'll give you an email address that you can contact. It's called CMOC, C-M-O-C, at setrac, S-E-T-R-A-C.org, CMOC at setrac.org, and that's regional. So that's for a 9-county region. So now outside the city of Houston, if you've got a local hospital that you want to donate some supplies to, that would be a way to get that information to them.
Dr. Purse, I have a question for you as well. It seems that the symptoms of coronavirus are being refined a little bit in terms of what people are showing with, and fever is not often now, they're saying, medical professionals saying, presenting as a symptom. So are you guys refining what people should be on the lookout for? Have you changed your...
Yeah, you're touching on something which is really kind of fascinating. So in China, we saw the symptom complex, and then as it spread to Italy, it changed a little bit. And here in the United States, we're seeing yet another little bit of a change. one of the things we're seeing in the United States is a little bit less fever and a little bit more GI disturbance, diarrhea in particular. And so it's a little early for us to say the CDC is tracking this and we're getting the word that they're observing changes. The case definition hasn't changed a whole lot yet, but it's just an interesting phenomenon that we're observing with this new virus, and we're going to stay on top of that. But the case definition hasn't changed greatly yet, but I wouldn't be surprised if it does.
And Mayor, I have a question about eviction protection. What about people
Yes.
who live in extended stays and can't afford to pay their weekly or monthly rent? Do they have any sort of eviction protection?
And that's a different twist. I know for in terms of people who are living in apartments or their mortgages and things of that nature, the evictions have been suspended until, I want to say, the end of April, if I'm not mistaken. Even the Texas Supreme Court has ordered a stay on evictions on that end. If you are living in an extended stay, I think that may. Let me check on that. I can't give you a definitive answer on that.
So, Mayor, we still get reports like, I think a couple gun ranges are still open to provide, I guess, entertainment for folks, or gun shops, and various other things are sort of, maybe perhaps in the gray area. Some people running CBD shops this morning were wondering, what do you say to, I mean, should those places be open? And if it's a gray area, what do you say to err on the side of caution?
And that's what I would say. If it's a gray area, please err on the side of caution. The main emphasis of this stay home, work safe ordinance is to stay home. And then understand what we are trying to do. And maybe this will help us all. The main point is to blunt the progression of this virus. And the other point is for us to do it now, over the next, let's say, 10 to 14 days. And if we work collectively and do it together to blunt the progression, then the goal is to flatten it out, the curve, so that the healthcare delivery system is not overwhelmed, and we don't see all of these cases coming in the next 2 to 3 weeks. That's the goal. And in order to achieve that, it will require compliance on everyone's part. And that is the reason why it's not just Harris County, Tarrant County, Dallas County, Travis County, in El Paso. You've seen all of these major urban centers since Sunday that have implemented these stay home, work safe orders, because we recognize that if we don't do it together, we're just going to have a very difficult time blunting the progression. But it will require people to change their behavior over the next 10 to 14 days. But if we do it, I'd rather us do it now than for this thing to drag out, and then it creates even more pain as we go down the road. That's the goal. And I'm hoping that people will err on the side of caution, stay home, and then let's work together to blunt the progression.
Mayor Turner, I think the city and the county has done a great job in preparedness and response. But we just got the information from Congress that the $2 trillion package, a bipartisan stimulus, has been passed. The deal has been accepted. I'm waiting for Congress, both houses, to vote on that. Mm-hmm. That haven't been said as the context of my question. How is Houston positioned, and how fast to get that which belongs to Houstonians so that we can mitigate and get some of these issues which are being addressed, like not paying mortgages and all the other things which are addressed in that package? How is Houston positioned, and how fast are we doing that to get that which belongs to the city?
Well, the $2 trillion is an agreement. It hasn't been fully passed by Congress as a whole yet and signed by the president. So a lot will depend on how quickly they get a bill to the president for the president to sign it. And then we'll simply have to wait and see how they have structured it, and how people can apply to get the benefits that have been put forth. I don't know the details of that at this point. Okay, Chief Buonick, is there anything that you want to add to this whole supply issue? Or I know we've been looking high and low for different PPEs and other things. So is there anything you want to add before we break up.
Yes, sir. Mayor, and thanks for your leadership, not only on a daily basis, but what sometimes seems like on an hourly basis through our conversations. The Office of Emergency Management is coordinating resources and services and requests for throughout the city. We're also coordinating donations. Just like this past week, we had the Asian Chamber of Commerce and the Home Depot donation. There's several other folks that are donating equipment and supplies. The Office of Emergency Management has been in contact with Harris County. We're working closely with them, the state of Texas, and through the federal government. Mayor Turner has signed a couple weeks ago letters that went up not only to the governor but to the president, requesting resources from the state supplies and through the federal supplies. And as Dr. Peirce said, right now for the testing sites, we're supposed to get equipment delivered on a weekly basis. We received the first weeks last week, and we're anticipating another shipment this week just to keep everything up and running.
Sure. It possibly could be used for that. It's a very broad sort of grant. It will help to supplement the cost the health department is having to incur in order to address this coronavirus. And so we'll have to look specifically at what the guidelines are to make sure that we stay within the necessary guidelines. But it certainly will be a tremendous help for us at this point in time. And then on the number, the county number for, if you have any question whether or not you are working for an employee of an essential business, okay. So let me be clear, because I think I gave a number earlier. If there is a question of whether or not you are working for an essential business under the Stay Home, Work Safe order, you can call the number that the county has provided, 832-839-6941. 832-839-6941. And if there's any question with regards to my 20,000 city employees to determine whether or not you're working for an essential employer, let me just save you the time. You don't have to call the number. The answer is yes, you are. Okay? Subject to the guidelines that the mayor has provided.
So that's a county number, so all the
That's it.
complaints are going to go through the county, and then
Yes.
they'll disperse into
Yes.
enforcement? Is that how it's going to work? Or?
Well, they'll go there, then if there's any issue, then we can also address it on the enforcement end. It's just one number that people can call through, and then the information can be disseminated to everybody else.
Mayor Turner, there's a group out there that is actually protesting, and they have all these placards about the church being closed down and fighting for the church to have the same rights like Walmart and the groceries and maybe the 20,000 employees of the city. So the point is there any problem for the church to meet outside, like the people in Atlanta and Alabama have been actually talking with the president on we meeting outside in the canopy and having the canopies have stretch out chairs of 10 people and do whatever we want to do. Is there a solution? Is there an advice from the city to them out there?
Well, I think you'll find that many, if not most, of the churches are now streaming their services, and I certainly appreciate them doing that. There are many churches through faith-based institutions, and I use that in a broad sense, that are still finding a way to worship with their members, and in doing it in such a way that's also helping to protect and enhance the safety of their members. And I want to thank them for doing that. I certainly recognize that prayer is important, and prayer does work. And someone who is a faith believer myself, I'm very sensitive to those issues. But I do want to thank the imams, our rabbis, our pastors, bishops, and others for joining in this effort. And many of them, separate and apart from the order that was put forth yesterday, many of them have already taken steps to protect and enhance the safety of their parishioners, of their members, and for that, I just want to say I'm very, very grateful. Okay, thank you all so very, very much.